Hi, I'm Carla. I'm a lactation consultant. I work at the OSF Breastfeeding Resource Center in Peoria. I've been a lactation consultant for 8 years, working in the inpatient and outpatient world. Today, I want to encourage you mothers who have been breastfeeding diligently, and now it's time to go back to work. You want to find a child care provider that will help you and support you in breastfeeding your baby. That's what I'm going to talk about today. You're going to need to observe a lot and ask questions. When you get to the facility for the first time and you're seeing if this is where you want to keep your baby, ask to see if there's a breastfeeding policy. Here's an example of one. Get it and read it. Ask if you can come anytime to breastfeed your baby, and ask if there's a place where you can breastfeed your baby in private and a place where you can pump if you need to pump there. Find out what kind of training the staff gets as far as how to breastfeed babies, or I know how to breastfeed babies, but how to bottle feed breastfed babies and how to store milk. When you take a tour of the facility, be sure to observe for signs that they encourage breastfeeding. One thing would be to look for brochures that support you as the mom in breastfeeding. Another thing would be to look for pictures of mothers breastfeeding, either posters on the wall or maybe coloring pages in children's books. Another thing would be to see if there's any books for the older children that depict mothers breastfeeding and encourage that. You will also want to ask to actually see the place where you can pump or breastfeed your baby, see the place where the milk is stored, and ask staff to tell you if they understand about paced bottle feeding and about cue-based feeding. Another thing you'll want to do is to ask parents of the children who already go there what their experiences have been. They are a great resource. They can give you negative and positive input. So you've observed, you've asked questions, and now you have to decide if this is the place for you and your baby. Even if some of these things aren't there, that doesn't mean that you can't have your child there. You might be a person that can bring some things in to have change come to that place. You could bring some books in for the older children with depicting breastfeeding. You might be able to bring in some information to the staff, such as this about paced bottle feeding. Whatever you do, be sure to be very positive. Thank the staff for all the things they're already doing. Express your needs very clearly and find out how you can work with them so that your goals and the goals of the staff are met. Deciding where you're going to have your baby when you go back to work is really important. And if you can find a place that supports breastfeeding, that will help you meet your goals of providing breast milk for your baby. So get your eyes open, ask the right questions, and then you can find the best fit for you and your baby.